Good morning. My name is Dr.Fran Feltner, and I am the Director of the Center of Excellence in Rural Health located in Appalachia, Kentucky. The high rates of cancers in the Appalachian area, colon cancer, breast cancer, cervical cancer, and especially lung cancer, we needed to look at ways of reaching people to get them in for preventative screening. The problem is that our mortality rates were really high years ago, and our screening rates were very low. So we looked at finding a solution to getting people in for screening. So patient navigation became very important in our community, and the fact that we enable people from the community to work with the community members to inform them and educate them on the importance of preventative care and preventative screening became very important. We choose people that are from the community to serve the community. And in Kentucky Home Place, we've had about 20-some years experience in training community health workers and patient navigators to be able to navigate the healthcare system, making sure that the services are provided for the people in need. It's hard to convince people that preventative screening is the thing to do when they are thinking about all the other barriers that might keep them from screening or to keep them from treatment. I've heard it said many times that poverty is not a diagnosis, but it does have to do with decision making when it comes to your health care. So how do we relieve those barriers? And that's where the patient navigators come in. And they know the system, they live in the system, they live in that community, they know where the resources are, and are able to talk that language for them to better understand the need of preventative care and for treatment. Sometimes it's a matter of making goals for people to make the right decisions and to have the right information to make the right decisions about treatment. A lot of times we think it's the fear of having screening done or whatever that might be or whatever that barrier is. But the navigators can get to what the barrier is and find solutions for that so that people can get in for their screening and treatment. The time is an issue between screening and diagnosis and getting to treatment if necessary for cancer. We don't have 6 months to wait to relieve those barriers. So patient navigators can quickly move through that system. In our experience, we've been able to reduce that number of days between the screening, diagnosis, and treatment for the people that we serve. When you look at training, there does need to be training for our patient navigators, and it needs to be Appalachia specific to our culture, that we understand the community that we're serving. So Kentucky Home Place has provided training for the last 20 years in Kentucky, and also nationally to different entities that have navigators or community health workers. It's important for them to have that basic knowledge and skill, that they have that initial training. Sometimes they need more training when it comes to a specific cancer. For an example, with lung cancer screening, we have just finished a training with our navigators to say, this is who qualifies for low-dose CT scanning. And how do we get that message out to the community to have that happen? Some interesting things about that, we found out that a positive message, let's get you screened so that we can, if we diagnose cancer early, there are solutions, there's treatment, so that we can live a life that we see our grandkids raised, so that we can participate in the activities of our families instead of looking at a negative side of it. Being positive about getting screening, and that comes through patient navigation. I think a lot of times you look at situations that navigators find themselves in, and they can rely on other navigators to say, I've been there, done that. This is where you can find the solution to what you're looking for. They can communicate with each other and be able to cross that barrier that they may have run into. I always say that there may be a brick wall, but there's a way around that wall, that coming together and finding solutions, we can reduce cancer in our Appalachian community.